This is a general explanation of spinal anesthesia. Please adjust the playback speed to make it easier to understand. Spinal anesthesia is a technique in which a fine needle is inserted into the lower back to administer a local anesthetic into the cerebrospinal fluid surrounding the spinal cord. This results in temporary numbness of the lower half of the body, eliminating pain sensation in the lower extremities. The effects of the anesthesia typically last for approximately 3 to 4 hours, during which the surgical procedure will take place. Once your surgery has been scheduled, please follow the provided instructions carefully and take care of your health. Should you experience any health concerns, please do not hesitate to contact us. You can eat dinner as usual the day before surgery. However, after that, you will not be able to eat until the surgery is completed. Please avoid snacks and other foods as well. Regarding fluids, in some cases, drinking water may be allowed under specific conditions. If you have not received any instructions, please confirm with your medical provider. On the day of surgery, you will be guided to the operating room and asked to lie down on a bed. Electrocardiogram monitors, a blood pressure cuff, and an oxygen monitor will be attached, and an intravenous line will be inserted. You will then be instructed to lie on your side. At this time, curling the back like a shrimp helps open the spaces between the vertebrae, making the procedure easier. After the doctor confirms the position of the spine, the area will be disinfected. Once the disinfectant dries, a sterile drape will be placed. The doctor will then inform you before injecting a local anesthetic with a fine needle. After confirming that the local anesthetic has taken effect, the spinal anesthesia procedure will begin. Spinal anesthesia involves passing a needle through the spaces between the vertebrae to reach the cerebrospinal fluid. Since this is a highly delicate technique, it is important to remain as still as possible. If you feel anything unusual, such as a sharp, electric shock-like pain, please inform the doctor immediately. Once the needle reaches the cerebrospinal fluid, the anesthetic medication will be injected, and the procedure will be complete. At this point, you may feel warmth in your legs or lower body, which is a normal effect of the anesthesia. Once the procedure is finished, you will be placed on your back, and the effectiveness of the anesthesia will be checked before the surgery begins. If you wish to sleep during the procedure, a sedative may be used to help you relax. Precautions. There are certain conditions under which spinal anesthesia may not be possible. If any of these apply, they should be communicated to the doctor. Additionally, if the spaces between the vertebrae are extremely narrow, the procedure may not be successful. Even if spinal anesthesia is successfully administered, in rare cases, the procedure may become difficult to continue. If this happens, the anesthesia may be switched to general anesthesia. Although the mortality rate is extremely low, any drop in blood pressure will be treated with medications and IV fluids. If excessive bleeding occurs, a blood transfusion may be required. In the unlikely event of an unexpected medical emergency, all necessary life-saving measures will be taken. In rare cases, you may be transferred to the intensive care unit for further monitoring. There are also rare complications such as an epidural hematoma, where uncontrolled bleeding inside the spine can compress the spinal cord, or cauda equina syndrome, which involves nerve damage affecting the lower spinal cord. More common complications include the following. If headaches, severe pain, numbness, or discomfort occurs, medical staff should be contacted immediately. This concludes the explanation. Thank you for your attention.